Welcome to Dewdear Academy. In this video, this is the continuation of MSc Nursing Entrance 2018 question paper discussion. And this is the part 5 of the question paper discussion. So the question is, a nurse to family member. It sounds like you are really afraid of what might happen to your husband. This statement reflects respect, sympathy, empathy, trust. A nurse is telling to family member, it sounds like you are really afraid of what might happen to your husband. So what does this statement reflects? Whether it is respect, sympathy, empathy or trust. So this from this statement it is clear this is not respect. So you can use the method of elimination. So respect is not correct, and this also shows the trust. Trust is also not correct. Then whether it is sympathy or empathy. Sympathy or empathy. So what is sympathy? Sympathy means it is to identify and communicate that you understand the patient's feelings. That is sympathy. Sympathy refers to the ability to take part in someone's feelings. That is, or showing sorrowful, feeling sorrowful about their misfortune. So that is sympathy. That is feeling sorry for someone. In simple words, we can say sympathy means feeling sorry for someone. Then what is empathy? What is empathy? Empathy refers to understanding another's state of mind, or it is the capacity to recognize the emotions or putting oneself into another's shoes. That is empathy. It is understanding another's state of mind is empathy. So let us discuss this with an example. Sympathy, we can give an example. I am sorry for your loss. I am sorry for your loss. If you are telling the statement, I am sorry for your loss. That is an example of sympathy. Okay, just an example. This statement shows sympathy, and empathy means I feel and understand your pain. My grandmother passed away last year as well. So in such cases, if you are telling, I feel and understand your pain, my grandmother passed away last year also. So that statement indicates I also had such type of experience, so that I can understand and feel and understand your pain. That is known as empathy. That is experiencing the emotions of another within oneself. That is empathy, or put oneself into another shoes. That is empathy. And sympathy means just we are communicating that you understand the feelings. That is sympathy. But you have experienced the emotions of others, and with that you are telling means that indicates empathy. So in this question, it sounds like you are really afraid of what might happen to your husband. So that is just a statement showing sympathy. Okay, this is a statement showing sympathy. So here the answer is option B. Option B is the answer, sympathy. Then the next question. The nurse monitors the patient for reactions after administration of drug. Which reaction has greater potential to be life-threatening? Options are idiosyncrasy, toxicity, habituation, anaphylaxis. The nurse monitors the patient for reactions after drug administration. And which reaction? So after drug administration, there are a lot of reactions we are expecting, like idiosyncrasy, toxicity, habituation, anaphylaxis. These are all the reactions. So among these reactions, which reaction is considered to be life-threatening or has greater potential to be life-threatening? So in this question, we should know what is idiosyncrasy. It is genetically determined abnormal reactivity to drug. Idiosyncrasy is mainly associated with unknown cause. Okay, it is not related to the pharmacological properties of the drug. It is not related to the pharmacological properties of the drug. It is mainly due to some kind of unknown cause. That is idiosyncrasy. Then toxicity is mainly associated with the drug overdose. There can be toxicity. Drug overdose may lead to toxicity. That can be due to drug overdose. Then habituation. Habituation means the repeated consumption of a drug produces a psychological dependence to the drug. Okay, that is a psychological dependence. Then next is anaphylaxis. What is anaphylaxis? Anaphylaxis means the reactions that are sudden life-threatening reactions because of the immunological reactions in the body. Because of the immunological reactions, if there are sudden life-threatening reactions occurring because of the drug administration, that is known as anaphylaxis. That is known as anaphylaxis. Clear? So, idiosyncrasy is due to the unknown cause. It is mainly causing some kind of abnormal reactivity, that is due to the unknown cause. Toxicity is mainly due to the drug overdose. And habituation means it is the psychological dependence to a particular drug because of repeated consumption of that drug. And anaphylaxis indicates the sudden life-threatening reactions mainly because of the immunological reactions within the body. So from this we know which reaction has greater potential to be life-threatening. The answer is option D. Okay, anaphylaxis. Option D is the answer. So here the next question. Dunn's theory of high-level wellness include the concept of health or sickness as it relates to an individual's options: age, environment, financial status, and past medical history. So in this question, we should know what is Dunn's theory of wellness, high-level wellness. Dunn is known as he is known as the father of wellness movement. Dunn is considered or known as the father of wellness movement, and he is mainly describing the term high-level wellness in his theory. So here you can see the diagram that indicating health axis, that is x-axis indicating the health, and the other y-axis is indicating the environmental axis, which indicate the very favorable environment on one end and not favorable environment on other side. You can see here very favorable environment and not favorable environment. Here we can see the health axis, you can see the peak wellness and death. So here the health axis is marked against the environmental axis, in which in this theory he is mentioning about the high level wellness. So the Dunn's theory of high level wellness include the concept of health as it is related to an individual's. Answer here is option B, that is environment. Environment is the answer. Option B, environment is the answer. Then the next question. The principal electrolyte present in extravascular compartment is options: sodium, magnesium, phosphate, and potassium. The principal electrolyte present in the extravascular compartment is. So here in this question we should know body fluid compartments. Body fluid compartments. Mainly this body fluid compartments, it is divided into intracellular fluid compartment and extracellular fluid compartment. Okay, intracellular fluid compartment and extracellular fluid compartment. So here this extracellular fluid compartment is again divided into intravascular and extravascular. Okay, it is divided into two, intravascular and extravascular compartment. This extravascular compartment is again divided into interstitial fluid, okay, interstitial fluid and transcellular fluid So these are the classification of body fluid compartments. Once more I will explain. Body fluid compartments is divided into ICF, intracellular fluid, and extracellular fluid. So in this intracellular fluid, the principal cation is potassium. In intracellular fluid, the principal cation is potassium, and in the extracellular fluid, the principal cation is sodium. Sodium is the major cation in extracellular fluid. In the intracellular fluid, major cation is potassium. In this question, the principal electrolyte present in the extravascular compartment. Extravascular compartment means here you can see extravascular compartment, that is included, that is coming, this extravascular compartment is coming in ECF. It is coming in ECF. So here the major cation is, the principal electrolyte is sodium. The principal electrolyte in extravascular compartment is sodium. So here the correct answer is option A, sodium. Then the next question. Dryness of the mouth resulting from salivary gland dysfunction is called xerostomia, chelosis, stomatitis, dehydration. Dryness of the mouth resulting from salivary gland dysfunction. The correct answer is xerostomia, that is also known as the dry mouth syndrome. Xerostomia is known as the dry mouth syndrome. And chelosis. Chelosis is a condition in which the corners of the mouth become inflamed. Corners of the mouth is getting inflamed and that can lead to cracking. That is chelosis. The stomatitis means the inflammation of the mouth and lips, mainly the mucous membrane of the mouth and lips. That is stomatitis. And dehydration, we know it occurs due to the loss of more fluids in our body, that is causing dehydration. So here, dryness of mouth or dry mouth syndrome, that is, answer is xerostomia. Okay, answer is option A, xerostomia. Then the next question. A nurse is performing CPR on an adult client. While performing the chest compressions, one should compress the sternum. Options 3/4 to 1 inch, half to 3/4 inch, 1.5 to 2 inches, then 2.5 to 3 inches. So this is question, we should know the CPR chest compression. We know CPR is a technique of basic life support for oxygenating the brain and heart in order to restore the normal heart and ventilatory action. So while doing this chest compression, the compression rate is 100 per minute. The rate is 100 per minute and the depth is 1.5 to 2 inches. Okay, the depth is 1.5 to 2 inches or 4 to 5 centimeter. 4 to 5 centimeter or 1.5 to 2 inches is the chest compression depth. Okay, depth of chest compression. So here the answer is 1.5 to 2 inch. Answer is option C. Okay. Then the next question. Asynchronous breathing with chest contractions during inspiration and expiration associated with multiple fracture ribs is. Options: paradoxical breathing, retraction breathing, Kussmaul's respiration and stertorous breathing. The question is chest contractions during inspiration, and they have mentioned the multiple fracture ribs. So that here we should know what is paradoxical breathing. What is paradoxical breathing? Paradoxical breathing means the chest wall moves in on inspiration and out on expiration. Okay, during inspiration the chest wall moves in and during expiration the chest wall moves out. That is reverse of the normal movement. Normal movement means during inspiration the chest wall moves out and during expiration the chest wall moves in. That is the normal movement. But in case of paradoxical breathing, just the reverse of normal movement occur. So the question here is chest contractions during inspiration. That means the chest wall move in on inspiration. That is indicating paradoxical breathing. And this paradoxical breathing is most commonly seen with fractured ribs and sternum. Okay, so here the question also it is mentioned multiple fractured ribs. So in case of fractured ribs and sternum, there can be the reversal of the normal breathing movement. That is the chest contractions or inward movement of the chest during inspiration may occur, and that condition is known as the paradoxical breathing. So here the answer is paradoxical breathing. Then what is retraction breathing? Retraction breathing means the intercostal retractions may occur. Mainly the chest pulls in with each breath, mainly found in case of infants and all. Chest retractions that can happen if the airway, upper airways get partially blocked. Chest retractions may occur. That is the intercostal muscles and all get sucked inward. Next is the Kussmaul's breathing. The Kussmaul's breathing means fast and deep breath that occur in metabolic acidosis. Okay. Diabetic ketoacidosis is the most common cause. So it is found in metabolic acidosis, Kussmaul's respiration. And the stertorous breathing, that is a noisy breathing that is resulting from the vibrations of the pharyngeal tissues. That is the nasopharynx, oropharynx and soft palate. Due to the vibrations of the pharyngeal tissues, there is noisy breathing, that is the stertorous breathing. That is also related to the upper airway obstruction. Like a snoring type or gasping type of respiratory sound is found. That is stertorous breathing. So in this question, the correct answer is option A, Paradoxical breathing. Paradoxical breathing is the answer. So thank you for watching this video.